Hi, everyone. Sorry, something just turned on outside and was making all this noise. I'm Kyle. Nice to see you. Welcome to this YouTube Live. I'm joined today by the one and only, and y'all like her a lot. I was reading the comments, Miss Jackie Colbeth. Jackie, hi. How are you?
I'm good. How are you?
I'm good. I'm good. I I haven't actually taken my antidepressant meds today, and we are talking about medications today.
Well, I mean, I've got coffee if you want to run and go get them.
Oh, I thought you were going to say I got coffee, which kind of is an antidepressant, which, you know, true.
I could make an art again. I'm not a doctor, but
But
I
if you
feel
were,
like it is.
yeah, yeah. The most used drug in the world is caffeine. Proud to say I'm one of the users.
Ditto.
Um, I was put on Prozac when I was 9,
Very young.
and
That's
I'm
very young.
37. Yeah, and I'm still on Prozac on 40 milligrams.
Yeah.
I used to have a huge problem though with taking an antidepressant.
I appreciate that. I mean, it's not like it's the most joyous part of your day where every day I get to remember why I
Yeah,
take this.
like a little reminder. Yeah, yeah. I didn't like it because I just always thought, "Am I always gonna have to be on this?" And I talked to my doctors, and they more or less said yes.
Yeah, I mean, right, everyone's different, but I too, like yourself, I am on medication. I've been like a guinea pig though. If you go
Mm.
through my like Rolodex of like whatever new drug Pfizer, Merck, whomever was putting out on the market, I mean, it's to the point where like, friends will be like, hey, they prescribed this. What do you think? And I laugh and I'm like, look, I barely graduated college with a communications degree, but like I have been on all these prescribed by doctors.
Yeah.
So surely, some feedback might be helpful.
Yeah, I mean, I think any feedback, especially if you're taking a new med and you're a little worried about it, and you know somebody who's been on it, and they can say, "Nah, it was cool," or "It was
Right.
okay," or "I handled it."
Right.
Um, I got put on last year 1 or 2 milligrams of Abilify, which is an
Oh,
antipsychotic medication,
yes. Yes.
and it
Yeah.
was prescribed to me as adjunct for my antidepressant, 40
Yep.
milligrams of Prozac, because when I go up on the Prozac to a certain level, my
Mhm.
vision gets weird, and,
Oh.
it doesn't go away or anything, but
No,
it's
but it's noticeable enough for you to be like,
yeah, like, if you're staring at the TV for too long, you're going like
right,
this. That's what it felt like. But when I stay on whatever it is, I'm on 40 right now, milligrams of Prozac, I don't notice a change in my vision, but I was still experiencing some symptomology at that lower dose. So
yep.
they there's a point to the story, by the way. They're like, "Why don't you go on this 2 milligrams of Abilify?" 2 things with that, 2 takeaways. One, this is why checking in so often with your provider and asking them, "Hey, is
Huge.
there anything new out there? Is there anything else going on?" Because no one had brought up Abilify to me ever in my whole life. And
Yep.
but this new study of this new thing came out and they go, "Oh, it can be used like that." And if you don't
Right.
ask, they might not tell you, you know? So number
Right.
1. Number 2, I was told to take it in the morning because it has all these uplifting effects.
Yep.
Well, I take it, I get exhausted.
Yeah. So it
I'm
has like
waking
an
up every morning taking a pill that makes me tired and then and I thought, well, I can't go off of this because or I can't change. No, I changed it. And I told my doctor, I'm like, I'm going to take this at night. She was like, no problem. Easy
Oh
going.
yeah, I mean, I think too, like to me, this topic I like because nobody was around to encourage it at the time that I was first seeking treatment as a child, basically a little older than 9, but 13ish. And it's one of those things where medications, affect everybody differently,
Uh-huh.
obviously, but it's something that, people would like, kind of hide or not talk about, or I remember one time there was a guy at work. We're on the same drug for our bipolar disorders. And we were literally in a conference room, and the pill bottle from Walgreens fell and like hit my foot, which was apropos of everybody's foot to hit. But really, you know, at the end of the day, you know, I kind of gave him like a little elbow, and I was like, oh, okay. Like, I see you. I see what you're on. But you know, it was perfect. It was like,
I think that's a great first date question. Just what prescriptions are you on? You know,
or what have you been on?
Yeah,
or
what have you been on?
You have for me to tell you what I've been on. But you know, they do come out so frequently. But I would say, and I'm making a long-winded point here, but to your point, new mental health is like a really new space. This isn't, you know, some like ancient wisdom that we have going on with our healthcare system. You know, having side effects from psychotropic drugs sucks. And I think the more people you tell them, look, if it sucks, there's other alternatives, whether it's different drugs, different doses, not drugs. I don't know. Again, I'm not a doctor.
Yeah.
But there are alternatives, and since they impact our bodies differently, keeping in contact with your doctor, in my case, a psychiatrist, to let them know whether I was feeling bad or having any sort of side effects, that's huge, because it shouldn't have to be like that.
Yeah, it definitely shouldn't. And I got quite the education from one of our MedCircle doctors, Dr. Dominic Sportelli. He's a psychiatrist out of New York, and he's a child and adolescent and adult psychiatrist, so he has experience in prescribing medications to a variety of populations. I sat down with him a couple years ago, and I'd like to share a clip from that interview, so let's take a look.
Dr. Dom, what is the process of a good physician when they're determining whether or not a patient should go on a medication for their mental health?
History, right? A good patient evaluation. When a patient comes in for a psychiatric disorder, let's say it's anxiety or depression, the best thing that you can do is take an incredibly thorough history, because that's going to dictate the treatment plan, right? So we are going to look at everything from your medical history to your child history, to your psychiatric history. Have you ever been on medicines before? Do you have any allergies, right? How long have you been experiencing these symptoms? We really want to, first of all, get an accurate diagnosis, because I say this all the time, that diagnosis is going to really dictate what treatment plan we're going to take and how effective that treatment plan is going to be, because the more on we are with that, the better off we're going to be long term, right? So history taking is huge. So a good doctor should be taking an incredibly thorough history. Number two, before anyone goes on any medication, they need a full medical workup, right? Now, as psychiatrists, we are medical physicians, but if you're seeing your primary care doctor or any other prescriber, they certainly should make sure that you get a full medical workup before starting any medication regimen. And the reason for that is we want to make sure, number one, there's no underlying reason why you have a psychiatric presentation, because remember, if you have a thyroid, I'm just going to throw a few out. If you have a thyroid problem, you could come across as depressed or anxious. You know, if you have a neurological issue, it could come across as depressed or anxious, or something else for that matter. So let's rule out all the medical issues that we might be able to tackle without a psychiatric medicine, okay? The second reason you're going to do that is to make sure that your body is healthy, in the sense of your liver function, your kidney function, your blood cell count. All of that looks good, because medicines can affect kidney function, they can affect liver function. So we want to make sure we're starting out with a really healthy person. And if someone has a deficiency or a medical problem, it might steer us differently with regard to the treatment plan. Okay, so a good doctor is going to take an amazingly thorough history, and we're going to do a full medical workup.
It's one of many reasons it's so critical that people are as honest as they can be when they're talking to their therapist or their psychiatrist, because when that doctor says, how often do you drink? Everyone always says a little less than they actually do. If they say, have you ever had thoughts of harming yourself or killing yourself? Some people are embarrassed and they say, oh no, none of that. When in actuality, the truth may be very different. And you can't give them the right advice if you don't have the accurate information.
We can only make a diagnosis based on what you tell us.
Listening to myself, that's such a reminder, the importance of honesty in therapy. It makes me think, am I really being 100% honest with my therapist today? Because
Oh,
it's so easy not to be.
no, it is. And I'll say, so I'll share this. So every time I move frequently, like throughout my
Well, you
life,
do move a lot.
I'm like a complete gypsy.
Yeah.
And I've lived all over, but part of moving is finding new psychiatrists, right?
Yeah.
Because I do take medication. They can't go over state lines, blah, 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 blah. So it's like, let's go get, to know the new one. So what I just do now, because I've been to so many by virtue of like my lifestyle at this point, like I breezed into the one here in Nashville about a year ago when I moved here. And I like breezed in. I'm like, hey, I'm just going to start with this. I know you're probably going to want to tinker with the meds because every time I see a new doctor, I don't know if it's like your stamp that you need to put on me as a new patient or what, but like, I'm not here to talk about changing medication for me that has been working for a long time. So just setting the precedent. We're not tinkering, yanking me on, off. Don't suggest anything until I start to have some sort of, poor reaction or inquiry. I'm doing well. Let sleeping dogs lie.
Like, well, are they amenable to that?
Well, yeah, because at this point now, I'm old enough and confident enough, like in my care, unlike when I was younger, where I'll say, is that cool? Because see, the bitch of it is I need a doctor to prescribe me medication. Yeah. But I also want the expectation that you will be there to prescribe this for me.
Yeah.
And that's not determined upon me trying the latest and greatest new drug, because sometimes that happens too. Well, how long have you been on it? So to me, just to be extra safe, I just went in and was like, look, this is the dose I've been taking. These are the drugs. I'm not interested in going on or off these. Can I still be a patient and just have you basically pick up the prescription baton from the last state I was in, because I'm feeling fine. I just moved.
Yeah, right, exactly.
I just moved, and I hate to say it, like there are certain doctors I'd love to keep, but like, that's not how our system's set up. So now I just kind of breeze in, like, this is how we're going to do
it. Did they ever try a non-medicated treatment first or at any point?
The only time I have never been on any medication, anything, was the first year of my sobriety. I went off all the antidepressants I'd been on while I was drinking. And I said, I want to know, I need a baseline.
Yeah.
You don't know me without something percolating, through my bloodstream. So for the first year, I said, I need to know if I have a real mental health issue, it'll present itself. Yeah. That's what they do. Yeah. So I did. And to me, it was the best thing I did. I went off anything and everything. Wow. And it was about a year into that. And now I don't second guess anything, because I know, like, okay, like I'm confident in the diagnosis now.
So when you went off all your medications and got sober in the same year, did your mental health issues present themselves?
Not until about really a year in, because let me tell you, I was like action packed with 12-step meetings.
Yeah. You were busy.
Time, like it was all I could do. I was working full time too. So it was like my whole daytime and like work was career stuff. And then any moment as soon after work was literally dedicated to just not picking up a drink. So it was like from the hours of like 6 p.m. through like midnight, all I could focus on was just not drinking.
You remind me of how powerful busyness is. I mean, if you are busy, it's so much more difficult to indulge in behaviors that may not be healthy for you. And it can be as extreme as drinking or drugging or something, but it can also just be like, oh, I'm going to text with somebody I don't even like because I'm not busy enough. I'm bored.
I hear my nana, my Catholic grandmother saying idle time or idle hands. Of course I got it wrong. Idle time or idle hands are the devil's playground.
Yeah.
And it was like any spare time. Like I used to think, oh, awesome. But like I abuse spare time.
Yeah.
Really. It's not like I'm not as good if I'm not busy. You're probably just not getting like the best of me.
Yeah. I think that might be true for a lot of people. I think that might be true. If you do have some spare time, I have a invitation on May 20th, just a live workshop with a few of our incredible Dr. Christine Lamb and Dr. Judy Ho. We're going to be talking about difficult personalities and relationships. We're going to be talking about stress, burnout, anxiety in the workplace, and how we can heal our trauma leveraging inner child work. You can register for this workshop for free using the links below this video. And if you can't attend live, all good, we will send you the replay. We do this very, very infrequently. So please take advantage of this opportunity to learn from some of the best minds in mental health. Jackie, you kind of make me think or want to go off of everything to get a baseline. But here's the deal, Jackie. You're like, don't do that. I would never do anything without talking to my doctor, of course.
Oh my God. This is like,
I'm an educated, empowered patient. I'm not going off anything without. But I also know where that will end up. So it's kind of like, why do I want to go down this road if I know that it leads to this neighborhood I don't want to be in?
And then people ask me when I share with them, like I was diagnosed with bipolar 2 disorder, a lot of people's first reactions are, do you take medication? And I just go, yeah, I mean, look, now between you and me and the rest of the audience, I mean, that's not, there's a different response I like to give people, which is like, you'll get to know that type of info once I get to know you better, but at the same time, it's, do you take medication? It's sort of like, well, yes, but like respectfully, what the hell would you know about like, are we ready to go into like a medication talk? You don't even really know what the disorder is, but it's sort of this, thing of like, well, do you take medication? I'm sort of like, yeah. Take lots of medications for lots of different things.
Yeah. I take my 40 milligrams of Prozac, my 2 milligrams of Abilify. I take about 3 to 7 milligrams of a medication called Colestipol, which is for my Crohn's disease.
Okay.
And then I take Propecia finasteride because I don't want to lose my hair. So those are the 4 medications I take. And as much as I was talking about, I don't like taking my antidepressant every day because it's that reminder. If I'm going to take a pill for my own vanity for my hair, I certainly can take a pill for my emotional,
But to your point, it's easier not to. Of course, there have been times I've put like picking up my prescription at Walgreens like 4th or 5th on my to-do list. Like I'll have
always get the 3rd reminder from CVS. I always wait a reminder.
Yes, and you see how easy, and I don't know if it's some like I feel out of control, so this is some weird control tactic, like having to take it. But really, at the end of the day, I kind of laugh at myself at this point, like, okay, yeah, that should have been the first, place you went to, like, make it more of a priority. That happens all the time.
Yeah. Okay. No, I think I lost you, Jackie.
I hear you. You're slowly coming back.
I was asking, how do you make sure you take your meds every day?
I put them near my toothbrush.
Perfect.
I mean, really? And it's been decades at this point, Kyle. It would be like me probably leaving the house without a shoe.
Yeah.
But at the same time too, of course, like you're human, or there's days or maybe even a couple days. What if I'm like traveling or this, that, where I don't prepare like enough. Yeah, that's, never fun, but it's definitely something that, I try to do religiously. I mean, just it's there. So like if I don't take it, it's because I thought about it and then jump track.
Yeah. Applaud everybody out there who is, and I'm getting some feedback that green is blurry, so I apologize, but I applaud everybody out there who has overcome the stigma of medication, who can now use it rather than feel like speak. And if you are struggling with finding a medication or a medication regimen that's working, I mean, I'm telling you, do not give up on that. There are so many options for the most case, and working with a great doctor, I'm finding some words doesn't have, you can't tolerate it. Any final words, especially since you're crystal clear?
Crystal, no, I'm glad that we're talking about this. I'm, happy that it's a subject people don't, have to like, hide them in a drawer or think that they're less than or feel less than. Because look, at the end of the day too, I tell people medication doesn't cure everything.
Okay.
Like, look, it's great. It can help. It can be of assistance, just like you're meditating or breathing exercises or hardcore exercises. Whatever you're doing, it's simply it's one component. So it's also not everything. It's just one little piece. And if that works for you, feel lucky that, we don't live in the 1800s and you're not getting like chucked in a snake pit. There are different, you don't have to feel bad if it's not necessary in this day and age.
Yes. Yeah. Well said. Again, we have a fantastic event, May 22nd. Sign up for it using the links below or just visit MedCircle.com, and you can register for free. We'll look forward to seeing you there. Jackie, lovely seeing you. And I think I get to see you tomorrow, don't I?
Yay, yes, we do. We're recapping my life.
Your life. She's lived. Now we're going to recap it.
And she's 42. She's done.
It sounds fab. This is the second season of your podcast that's coming out that we're recapping. Yep. Excellent. It's all in your head. So make sure you subscribe to this channel so you don't miss any of our doctors, any of me and Jackie. Hello. You don't want to miss that. And of course, Jackie's podcast. It's all in your head. Thank you for watching. Remember, whatever you're going through, you got this.